Hello everyone, this is Joni Liddell. I'm an LPN to BSN student from Indiana State University, and this is my presentation on tips to maintain accountability, ethics, and legality as a nurse, and this is related to healthcare dilemmas that you may encounter. I hope you enjoy this. So our population at risk are going to be nurses and their patients. So nurses are going to be making ethical, moral, and philosophical decisions, sometimes based off of institutional policy, Nurse Practice Act, federal laws, and sometimes based off of advanced directives, and many, many more other examples. So our objectives. At this time, if you'd like, you can check out my pre and post test that's attached to the information with this video. But the objectives that we're hoping to reach are, what is the healthcare dilemma? So we're going to define that. We're going to define what nursing accountability means. We'll talk a little bit about ethics in nursing, legality in nursing, some tips you can use to protect yourself, and then a few resources. So what is a healthcare dilemma? So ethical or healthcare dilemmas are choosing between two or more challenging directives or actions that involve the moral decision-making process. So basically, you have a dilemma and you have to decide between right and wrong for the situation based on the information that's available to you. And a few examples of some healthcare dilemmas you may encounter include confidentiality. Are you going to follow HIPAA privacy laws? And are you releasing information to the appropriate parties at the appropriate times? Do not resuscitate orders. So this is a form of advanced directive. There's some controversy related to do not resuscitate orders being tattooed on someone in some states, but it's definitely an expression of the patient's wishes, and so that should be respected and followed through with if that's what they want. Advanced directives and post forms. Informed consent laws. So are you taking the time to go over the nature of the treatment, any alternatives that may be available? Are you going to go through the risks and the benefits? Allow the patient to ask any questions that they may have, and then have a signed informed consent with a witness. Nursing accountability. So a nurse's professional accountability comes from the ability to hold yourself responsible for your own actions or decisions, as well as taking ownership of that responsibility of your actions or decisions to others on the healthcare team, including your supervisors and peers. Ethics in nursing. So ethics are the nurse's moral definition of right and wrong. Are you honest? Do you have integrity? Are you respectful of the patient's wishes? And this can be influenced by institutional policies. This can be influenced by personal beliefs. It can also be influenced just by educational background. So a lot of different ways that your personal kind of moral compass directs you to act. So legality in nursing. So your nursing licensure and the practice of nursing, they're bound by state nursing practice acts and federal laws. And then taking that a step further would be your institutional policy and procedure guidelines, which you also need to uphold as a professional nurse. So here are some ways that you can protect yourself, your patient, and your license. So maintain the patient's privacy. Make sure that you are following HIPAA laws, that you are releasing things appropriately. You're not sharing results with family members that aren't supposed to know. Just really making sure that you are respecting the patient's wishes and their privacy. Be their advocate. If a patient's family feels really strongly one way, but you know the patient feels another way, or you have it in writing from the patient, or you have their advanced directive form, you have to be able to speak up on their behalf. That's also important with other medical professionals, including physicians and other nurses that may be caring for your patient. Documentation. If it wasn't documented, it didn't happen. So making sure that you cross those T's and dot your I's and make sure that you're doing clear, concise documentation is going to protect you in any legal situations. Following the chain of custody. So if you are collecting evidence for a court case, or there are police officers that are needing to ask you a bunch of questions, make sure that you're properly following the chain of custody. And if you're unsure of how that policy goes, I would definitely look at your institutional policies and procedures, or chat with your supervisor or another seasoned nurse that's around you that may be more familiar. We need to be culturally sensitive. Our beliefs are not the same as everyone else's. If they do not believe that something is going to work scientifically, we have to respect that. If they do not want a treatment, we need to respect that. We can't force things upon people. They have to be agreeable to it and they have to sign for it. So maintaining that appropriate boundary between a patient's, cultural, religious, and other beliefs is very, very important. Also, we want to allow our patients to be autonomous. We want them to be able to make their own decisions without anybody influencing them. They should have all the facts, and they should be able to make those decisions in the most informed way possible. And if they have questions or they need to talk to someone else, if you need to delay a procedure to make sure that they are fully understanding the procedure that's going to happen, I would make sure that you take those necessary steps to give them that extra time to ask all the necessary questions that they have. Resources. So our first one is a journal article about ethical dilemmas in the care of cancer patients near the end of life. The next article is the importance of professional accountability. Then we have the Code of Medical Ethics from the American Medical Association. An article about nursing ethical considerations. And then ethical issues in nursing, explanations and solutions. And that's a university article that I found. So if in doubt, consult a legal department, consult HR, consult supervisors, or consult your seasoned peers. The right and wrong decision could have a huge impact on your livelihood or your licensure in your career. And so you definitely want to make sensible decisions that are made with your license in mind and protecting yourself as well as your patient. Thank you for watching my presentation. I hope that you enjoyed it.